Today, we will study a commonly seen disease, headache. Headache is a subjective symptom. It can be induced by various acute or chronic diseases. Almost every one of us have suffered it. For the differentiation, mostly there are two different methods. One is according to the pain area to diagnose which meridian is abnormal. The other is based on the different characteristic of the pain and the accompanied symptoms to diagnose the certain syndrome. For the differentiation, according to the pain area, always it's like that. If the pain exists on forehead as the cause of yang ming meridian reaches to forehead, so we know this kind of headache is caused by disorder of yang ming meridian. We need to select acupoints of yang ming meridian to treat the headache. If the pain exists on lateral head, it's on the cause of Shaoyang meridian. So the Shaoyang meridian is abnormal. If the pain exists on posterior head, we know it's the disorder of Taiyang meridian. And if the pain exists on vortex, which liver meridian connect with, so we should regulate Jueyin meridian. Then, let's see the differentiation according to the different characteristics of the pain and the accompanied symptoms. Based on them, it's easy to diagnose the syndromes. Usually, there are 5 kinds of syndromes. First, it's invasion of pathogenic wind, especially in common cold. Always, it's accompanied with fever, afraid of wind or coldness, thin and white tongue coating, floating pulse. Second, it's upsurging of liver yang. For this kind, the characteristics is headache with head distension, dizziness, irritability, blurred vision, red tongue with thin and yellow coating, wiry and rapid pulse. Third, it's deficiency of both qi and blood. For this one, not like the above two, it always has a long course and happens again and again. We call it lingering headache, accompanied with dizziness, lassitude, lustreless face, pale tongue with white coating, thin and weak pulse. Fourth, it's excessive phlegm and dampness. For this syndrome, the characteristic is headache with having sensation of head, always accompanied with nausea, vomiting, watery tongue coating with teeth mark, slippery pulse. 15th, is excessive blood stasis. For this kind, the characteristic of headache is severe fixed area, stabbing pain, dark purplish tongue, choppy pulse. Sometimes the blood stasis can be caused by trauma. These are the 5 commonly seen syndromes. One is deficiency syndrome. The other 4 are excessive ones. Next, let's see the treatment of acupuncture and moxibustion. Generally, the basic acupoints are formed by local points and the remote points together. For forehead pain, we use 上心 do 23, 阳白 GB 14, 印堂 do 29 as local acupoints, and the 合谷 large intestine 4, 线谷 stomach 43 of Yangming meridian as remote points. Second, for lateral headache, you say migraine, it's the same. We use 分池 GB 20, 太阳 extra point, 率谷 GB 8 as local acupoints, and 中渚 三焦 3, 足灵气 GB 41 of Shaoyang meridians as remote points. Third, vortex headache. We use 百会 do 20, 四神村 extra point as local acupoints, and 太冲 level 3, 内关 pericardium 6 of 厥阴 meridian as remote points. 4. Occipital headache. We use 分池 GB 20, 天柱 UB 10 as local acupoints, and 后溪 small intestine 3, 束骨 UB 65 as remote points. Fifth, for the headache of whole head, usually we use 分池 GB 20, 百会 do 20, 印堂 do 29, 太阳 extra point, and 合谷 large intestine 4, 列缺 lung 7 together. Besides the basic acupoints, according to the different syndromes, we should add supplementary points. For wind cord syndrome, add 分池 GB 20, 合谷 large intestine 4. For liver yang upsurgence syndrome, and 太冲 level 3, 肝腧 UB 18. For deficiency of qi and blood syndrome, and 三阴交 spleen 6, 足三里 stomach 36. For excessive phlegm and dampness syndrome, and 中脘 Ren 12, 分龙 stomach 40. For blood stasis syndrome, and 膈腧 UB 17, 血海 SP 10. Note: the indications of acupuncture and moxibustion treatment are mainly the headache caused by functional changes, such as vascular headache, nervous headache, etc. If headache caused by brain organic changes, the treatment of acupuncture and moxibustion could only be a supplementary method. That's all. Thank you.